When I realized I had pelvic organ prolapse, the first thing that I wanted to know was simple. It was, okay, so what do I actually do about this? And it turns out there's not just one answer. There's really a few. Pelvic floor physical therapy, a pessary, surgery, exercises, daily support garments, breath work. Your body isn't broken. It just changes, and your support needs may also need to change. By the end of this video, you will understand what each of these options actually is, who each one tends to help, and how to think about which mix is right for you and your symptoms. Let's start with the one that almost everybody hears about first. This is where I think about my own experience and like how I was just launched into this space. And so I think what I first heard about was pelvic floor physical therapy. Thankfully, before I even knew that I had prolapse, I already had a package of visits with the pelvic floor PT. And that was because she just happened to go to this community group with other pregnant women. And I just saw how valuable I thought it would be. And thankfully I had that. And so I had visits lined up with her. And so pelvic floor PT, especially if you're coming at this first through pregnancy, can often be one of the first things that you hear about as a potential option. For many people, when they are diagnosed, you don't necessarily get a ton of direction. It really depends on, what environment you're in, those kinds of things. But a lot of times it can feel like you get that diagnosis and then you are on your own for figuring out what to do next. And the good thing is that you don't have to pick one option and then commit to it forever. These are not either or. Most women end up chasing a few of these options together. And the good thing about that is that there's not one single right answer, which is really good news, because it means you get to build what fits your life. And in doing that, when we look at these different options, it's not that we are ranking them as treatments. We're really looking for different ways to help mitigate your symptoms day to day. And a lot of times, those symptoms may vary, especially over the course of your life. So here, we'll talk about option one, which is pelvic floor physical therapy. Like I said, that was one of the first ones that I heard about. I had that package, and I'm so grateful I did, because when I was first diagnosed and I had raised it to a healthcare professional, they essentially dismissed what I thought. I thought I had prolapse, and they dismissed that. And when I saw my pelvic floor PT, thankfully, she confirmed that I did in fact have prolapse. And I've kept that relationship with her from the moment that I had my first baby through now. And I have two kids, and my youngest is now 4 years old. And so now I've switched to seeing her on an annual basis as my symptoms have changed and improved over time. And so you might be thinking what PT actually involves. So in simple terms, it's not just Kegels. It's definitely not that. And it's really important to understand that. They start by having an assessment of how your whole core and pelvic floor are working together. And then they built a plan for your symptoms, your lifestyle, and your goals. This can include things like, during the session, like hands-on work with your body. It can be showing you breathing coordination, how to build strength, and then sometimes learning how to relax your muscles that are too tight. For example, in my last visit about a month ago, one of the things we're focusing on for me is my hips and how they've had a lot of tightness. And what you learn as you're in this space more often is just how interconnected your pelvic floor is with everything. And so things like tight hips can have impacts on prolapse symptoms. And so then, as far as who this helps, really anyone with pelvic floor symptoms should see a pelvic floor PT if it's possible. And it's definitely one of the first things you should try, because it helps then inform everything else that it is that you might want to do. It takes consistency. It can take time. It's this practice. Seeing a PT is not a quick fix. Like with, most good things, they come with work and putting in effort and, seeing things out over time. But a good PT can really help you meet your goals and get to where you want to be. So the next step on that note would be that you would want to ask your provider for a referral to see a pelvic floor PT, or find one directly. And depending on your state, you may or may not need that referral. And we have a pelvic health resources page that we will link in the description below. Option two is a pessary. So a pessary is an internal support device that you can either manage yourself or your healthcare provider can help you manage. I wanted one early in my journey, and it was really before it's amazing even in the last 5 years how much research has come out over pessaries and the impact they can have for prolapse. I wanted one early in my journey. I reached out to a provider that was not my pelvic floor PT because my pelvic floor PT didn't fit for them at the time. And I had to wait over a year before I finally got fitted for one, which was incredibly frustrating. And that's a whole different story that we can cover in a different video. But once I finally got fitted, I ended up getting a ring with support. And for me, it has been a complete game changer. So like I was saying, the Pessary is internal support. It's a small, flexible, medical grade silicone device that fits inside the vagina and often rests on the pubic bone, or depending on the type, it might sit in slightly different places and stay in using different mechanisms. But the goal is that it holds everything up so that you're in a more comfortable position. There's many shapes and sizes. It's based on, again, your body and what's going on with it. And it's not a one size fits all. And if whatever you get the first time doesn't work, it's worth trying a couple of different options, because the size can make a huge difference. The style can make a huge difference. Just learning what it should feel like can make a big difference. Some of the pros of this options are that it provides immediate support, it's reusable, it's non-surgical, and once you're shown how, you can often manage it yourself. And again, this depends on, your abilities and those kinds of things. But for what I have, I manage myself. I take it in and out, and then I just check in with my provider annually on how things are going. Some of the cons of pessaries are that getting the right fit can take trial and error. So like I was saying, it can be hard to get right on that first try. Some women can't tolerate it for various reasons. There may be waiting or a fitting hurdle that you have to get through, like me. I had to wait over an entire year until I could get to the right person to fit me for one. And then there's maintenance and occasional adjusting. So depending on where you live, what resources you have, sometimes this could be challenging depending on what you have going on. So down in the description, I did include a link to my full story about my experience trying to get a pessary, in case that is something that is of interest to you. So it's in the link below. Real quick, just because it fits right here, thinking about these different options, one thing that really helped me get through a lot of this was actually paying attention to my symptoms instead of either just guessing or not noticing how things are changing over time. When you can see what makes the heaviness better or worse, what time of day it shows up, what were you doing, it can be so much easier to have real informed conversations with your providers, which can also help you understand which of these options might make more sense for you. Because at least for me, like what I have found over and over again is I would, have an appointment with my provider. I would get in there. They would ask me questions about how I was feeling, and I would just really kind of have that like recency bias, where I would just be thinking about like today or yesterday or the biggest, most recent thing that came to mind, and not really looking holistically about the last week, weeks, or months to really talk about how am I feeling? How am I doing? And how do different things that I do impact me? So we made a free symptom tracker, which is just a simple way to start noticing your own patterns. The link for that is also in the description below if you'd like it and if you want to see if it can help you. Okay, back to it. So option 3 is surgery. So this is an option that I haven't pursued myself at this point. Not to say that I never will, it's just with where I am with everything, I haven't looked into it from a personal perspective, because I've been able to manage my symptoms in a way that feels good for me right now. Again, it's not to say it's off the table forever. It's just I haven't. It's not a bridge I've had to cross yet. But that doesn't mean I haven't researched it, looked into it, or talked to other people about it. So it's really something that comes up when symptoms are really affecting people's daily life, and then the other options either are not the right fit or may not have given enough support, or just personally you feel like that's the right way for you to go. And the decision can depend on a lot of different things, including how severe your symptoms are, what support you're getting from healthcare professionals, and then your overall health. The common goal of surgery is to try to restore support to the pelvic organs so that that bulge and heaviness are reduced. There are many different types of surgeries, from repairs that rebuild the support using your own tissue, to procedures that are actually done through the vagina with no abdominal incision at all. A newer option that I have found interesting is actually an incision-free approach that's called Mend It. And it's where the surgeon anchors the vaginal wall back into position, going through the vagina, again, without having to make incisions. It's a newer option I've read about. I haven't talked to anybody personally who has tested it, but people are working on solutions actively, and there are new options coming out, and that's where it can be worth talking with your provider about, what are those options? Could they be a right fit for you? And then what are the pros and cons? And then as you're thinking about it, part of that discussion is recovery. This can vary based on the procedure. You would expect things like some time off. You might have limits on heavy lifting, vigorous exercise, or straining for some time, while your body's recovering. Again, depending on the type of procedure and those kinds of things. This is stuff that you would want to know. And it's stuff that you would just talk with your surgeon about, and they would help you understand. And then you can determine if it's the best fit for you. So some of those questions that you would want to ask a provider are, what type of repair do you recommend for my prolapse and why? What is recovery like for that specific procedure? What are the chances that it comes back? And then is my family planning a factor, depending on if you're still having kids or not? Am I a candidate for a less invasive or incision-free option? And this is where you can just begin to kind of put those facts together to see if this is an option that feels right for you. So for the next step for that one is going to be to talk with a urogynecologist or a pelvic floor surgeon and have that conversation. Option 4 is support garments. So here, this is one of the ones that I know best and can speak to because it is why hem support wear exists. The great thing about support garments is that they are one of the lowest barrier to entry options. With many of these other things, they take time, or you have to see a healthcare provider or different things like that. With a support garment, you can simply get one and try it and see if it helps you feel better in the very immediate term. And it's not to say that it should take away these other options. Again, I really like to think of these things together like a toolkit, but it can help provide some immediate relief while you are navigating the other parts of this journey. Now, what is it actually? So with our garments, it's underwear with this built-in hammock and support panel that gives this gentle lift and counter pressure to your pelvic floor. So I really like to think of it like an ankle brace. So you sprain your ankle and you wear a brace, and that counter pressure and support is what helps you move, be comfortable, and reduce those symptoms while your body is healing from that sprain. This is the same idea, is that if you're postpartum, for example, you can wear the garment while your body is recovering from the hormonal changes and from the taxing thing your body's gone through from pregnancy and delivery. And then if you're older, it still fits in just as beautifully, and it can help support you as you're pursuing these different options and be part of your toolkit. So where it fits in that toolbox, again, it's not a replacement for a PT. It's not a replacement for a pessary or a provider. I know many people who wear a pessary and external support, depending on what kind of activities that you're doing. It sits alongside them. So it's the everyday put it on and go layer for the hours when you are on your feet and you want to feel held, not held back. So what it does is it can help you feel more supported through heaviness, pressure, and that falling out sensation during your day. It doesn't cure prolapse. It doesn't replace those other tools, which is really important for you to know as you're considering these different options. It's there to help people who want daily wearable support that you don't have to think about, and who want something that looks and feels like normal underwear and not like a medical brace, and not like something that's going to really bother you and show through your clothes and make you feel like you have a problem. Ours are amazing. Again, they're designed from personal experience. I didn't like my options when I first had my baby and turned to external support. And so I really just wanted to design something that felt seamless in my clothing so that no matter what I was wearing, I would have an option that also just made me feel like me. The last thing I wanted was something that made me feel like it was exacerbating the problem that I was already trying to address. So we'll have a link to the size quiz below if you want some help to give us a try, see if this might be one of those options that could be a great fit for you. And we're always here and available to help answer any questions that you may have. So this is where, as we look at all of these things together, there's not a right answer. Again, like, your options might change over time. The things that you turn to might change over time. Your symptoms may change over time, and therefore your support changes. It might be that your kids have gotten older and you don't have to lift them up as much, or maybe now you have grandkids and you are having to lift kids up a lot. So for me right now, for example, it's my annual pelvic floor PT appointment. I focus heavily on strength training. I take a collagen supplement. I love my ring Pessary with support, and I have my external support garments. And I just, use those things in conjunction with each other. And that's the mix that works for my life right now. And I fully expect that to change over time and be different 5 years from now, say. So the good thing is that you're not choosing one thing forever. You're building this toolbox so that as things change, you can add and remove and change tools as your body changes over time. So if you're sitting here with this new diagnosis and you're feeling like you have to pick the right answer, I really want to take that pressure off of you, because there isn't a single right answer. There's this mix that fits your body for where your life is right now, and you get to build that with your provider, one tool at a time. Again, you've heard what my mix is like. Yours might look different, and it might need to change. And that is exactly how this is supposed to work. If it would help you to start noticing your own patterns and being able to capture that over time, we do have that free symptom tracker down below, which again is a great first step as you start to explore these different options that are available. Take care of yourself, check out these options, and we'll see you in the next video.